Has your family ever been out with the same illness? Well, chances are you were out with the bug of all bugs, the stomach bug, also known as the norovirus. This segment is about the norovirus and how you and your family can recognize the virus and treat it without much difficulty. To understand this virus, we will talk to Dr. Sheldon from the Arlington Pediatrics.
So what is the norovirus?
So norovirus is a part of a group of viruses called enteroviruses, which is what we call most commonly tummy bugs. And noro itself is actually known for infecting people on cruise ships. That's the sort of the classic description of it that you learn in medical school, is that people on cruises, because they're stuck in one spot, tend to get this norovirus. It's a vomiting and diarrheal illness that tends to come around this time of year, which is what we're seeing.
So where did the norovirus originate?
It's named for Norwalk, Connecticut, actually.
What are some of the symptoms for the norovirus?
Norovirus is a bad belly illness, so lots of throwing up, belly cramping and pain, and followed by diarrhea. It typically starts with vomiting, goes to vomiting and diarrhea, and then diarrhea alone.
When should common patients see the doctor, and when should they be worried?
The only reason to worry with any kind of viral gastroenteritis is if you're getting so dehydrated that you're starting to feel really sick and lethargic. So reasons that patients should come see the doctor, pediatric patients, obviously it's their parents who have to decide when they come in. But if young children are looking really out of it, really pokey and kind of laying around, just not wanting to do anything, we always say if your baby looks like a wet dish rag, you should come in. And signs that little kids are getting dry are the same as signs that adults are getting dry. They get dry, cracked lips, they get really tired, and then with babies it's easy to tell if they're not making wet diapers. So if a baby doesn't make a wet diaper for 12 to 18 hours, they should absolutely be seen. Then the next step is, when do you need to go to the emergency room to get IV fluids? And what I tell parents is, if the idea of someone sticking your baby with a needle is less horrifying to you than the way your baby looks right now, then it's probably time to go to the emergency room.
What are some common time and money-saving ways that people can prevent the spread of the norovirus?
Time and money-saving ways, I think easy and inexpensive ways to spread any disease is just constant hand washing. Any of these diseases, the spread is through contact with germs, and hands are the way that those things get spread for the most part. So just hand washing. If you have someone in the family with it, you want to keep them separate. Always wash hands after changing diapers or going to the bathroom. It happens to kids, adults, and the elderly. So obviously the age ranges that are most affected are going to be young kids and older adults, just because they don't have the kind of fluid reserves to stay hydrated. But anybody can get it.
Now you know how to protect yourself against the bug of all bugs, the stomach bug, also known as the norovirus.